If you or your child has had an injury to your head, what is the difference between a simple bump on the head and an actual concussion? A bump on the head will have an injury that's sustained to the head that results in pain and swelling, but tends to subside over time. Typically, the pain will go away within a couple days. A concussion, on the other hand, is an injury to the head that results in longer-lasting symptoms, such as dizziness, loss of consciousness, brain fog, light sensitivity, difficulty processing, and feeling dazed or confused. A concussion can have symptoms that last days, weeks, or even months after the injury. When you or your child has had a concussion, who are the key players that you need to get on your team? First of all, you should be managed not only by your primary care physician, but probably by a neurologist. You also can consider seeking out a medical doctor who has a sports medicine fellowship. These doctors are specially trained to deal with sports injuries such as concussions. Next, you should also consider to reach out to other specialists such as a physical therapist. There are physical therapists that specialize in dizziness and balance issues that can result after injury. Then you should also consider maybe a neuropsychologist. Neuropsychologists are able to evaluate your processing, whether that be auditory and visual processing, to see if there has been an effect to your processing speed, hence that term brain fog. And lastly, optometrists. Optometrists that specialize in neuro-optometric rehabilitation can help you to diagnose and treat the vision symptoms that you may have after suffering a concussion. Let's talk about the current treatments that are recommended after a concussion. First of all, you should absolutely have any recommended scans done, such as an MRI or a CT scan, to make sure that there is no structural damage. Secondly, you are probably recommended to have rest. Back in the old days, they used to think that to treat a concussion, you should stay in a completely dark room for a couple days. That is now no longer the recommendation. Recommended is that you should engage in normal daily activities, but at a modified level. So that might be limited physical activity, limited screen time. Next, after suffering a concussion, if suffering with pain, you may need to see your doctor or a neurologist to prescribe some pain management medication. Also, if you're experiencing that brain fog, things like cognitive therapy can really help to regenerate or to refresh the processing system in order to be able to help you to think clearly again. And lastly, don't forget about your eye doctor. Your eye doctor can be very helpful in prescribing certain lenses that can make your eyes feel less fatigued, or even special lenses that can help to decrease your light sensitivity. We can help coach you through some exercises to retrain your vision system to regain the strength back so that you can function again by being able to use your computer or read again. Lastly, a physical therapist can be very helpful in doing both evaluation and treatment for dizziness and balance issues following a concussion. Gradually, our goal as a collective team is to get you back on your feet. We want you to be able to get back to play, get back on the field again, be able to do the activities that you love, such as reading, using the computer, being able to drive again. Dealing with a concussion definitely takes a team approach. You want to make sure that you have the right players on your team to help you rehabilitate to be able to get you back to where you want to be. If you're having vision issues after concussion, don't forget to reach out to your optometrist or to ask for an optometrist that specializes in neuro-optometric rehabilitation. We absolutely can help you with any vision symptoms that you're having post-injury.